Hello, good afternoon, Facebook. So happy you are joining us today for the Doctor is In segment. I am Devin Walsh, and we are joined by Dr. Brian Heller with the Southern Cancer Center. Dr. Heller, thanks for being with us.
Thank you again.
I know that there are a lot of cancer myths that circulate out there, a lot of misinformation. So today we're going to be debunking those myths, telling you the truth. And this is your opportunity to also ask Dr. Heller questions. So I am going to pull up our Facebook Live segment right here on my phone, and I'll ask your questions directly to Dr. Heller. So if you've heard something about cancer and you're wondering if it's true, this is your chance to ask the doctor directly. All right, Dr. Heller, let's start out with one of the common cancer myths, and that is cancer is contagious.
So we hear this a lot, and we also hear that all of us have cancer in our bodies, and it's not true. You definitely cannot catch cancer from other people, and it's also true that it's also not true that we all harbor some cancer cells.
Okay, yeah, I've heard that oh, we just have cancer in our body and it'll kind of come to life in some people and others it won't. So that's not true.
It's not. Now, it could be that there is cancer attempts to arise in our bodies, but it is then defeated by our immune system. That could happen behind the scenes, but that cancer comes up in people likely from different mutations that their body can have, whether those mutations are caused by smoking, chemical exposure, etc.
Okay. All right. Let's move through some of these myths. Let's talk about our diet. A lot of people are wondering whether eating sugar can make cancer worse.
Absolutely. And this is something that I commonly get asked in my clinic from all different types of cancer patients. And the first thing I tell any patient when I'm discussing a cancer myth is that patients sometimes feel attacked if I argue against their myth. And discuss these things with your physician, because like this myth, it is not that doctors are attacking you. What they're trying to do is share with you their knowledge. With sugar and cancer, it is true, all the nutrients that we take into our body have to convert them over to sugar to feed our body. So cancer cells feed off of sugar, but so do our cells. And just like it would be ridiculous if I said you have to not take in any oxygen or not drink any water, it's the same thing. You can't avoid sugar. So eating sugar does not harm you or feed your cancer.
Okay, what about artificial sweeteners? Do artificial sweeteners, I'll say the myth, artificial sweeteners cause cancer?
Yes, again, this is actually a very well-studied field. It's been looked at extensively, and none of the artificial sweeteners that are available in the market in the United States cause cancer. It was studied in animals, and there was some hint that in extremely large doses that would be impossible for humans to even take in might increase the risk. But in humans, that was not the case. Okay,
because I always heard that, oh, don't drink that Diet Coke, don't drink that Diet Mountain Dew.
And as you can tell, a lot of these myths are based on some grain of truth that is not applicable to humans. And I always try and point that out, because again, I'm not trying to attack the patient and their beliefs. I'm just trying to share knowledge with them so we can come to understanding.
Okay, let's see. We have just a medical question that I will ask you quickly, and then we're going to go back to focus on our cancer myths. Melinda says she is in remission of ITP. Platelets went from 2 in 2018, staying over 300,000 for 2 years now. Am diabetic, take metformin. Her primary care doctor wants her to add glipizide. Afraid it can possibly lower platelets. Should I take it?
Obviously, discuss it with your doctor, but that should not be a problem. That particular disease, ITP, is the immune system attacking your own platelets, so adding that drug should not cause a problem.
Okay. All right. Tamela says, I had my first skin cancer at 23, but I've not had any other kind, and I'm now 76 years old. Several people say if you have skin cancer, then you will have other kinds of cancer. Is that true?
It's not true unless you have more than one type of skin cancer or there's certain aspects of that skin cancer. It sounds like that in that instance, that was obviously, it was so long ago that that was an isolated instance. But in particular having skin cancer does not increase your risk of other cancers.
Okay, yeah, because she was pretty young at 23 to get skin cancer.
Absolutely.
So I can see how she would have been concerned, but now that she's 76, hopefully that she'll stay cancer-free for the rest of her life. All right, let's see. cancer surgery, we're going back to the myths. Cancer surgery or a tumor biopsy can cause cancer to spread in the body.
Yes, this is very common, and this is another myth based on some grain of truth. And what it goes back to is, at first, the only methods we had to treat cancer were surgery and maybe radiation. So they would have somebody who was very ill, the surgeon would open them up to figure out whether they could cut the cancer out. They would look in the patient's abdominal cavity, their chest cavity, and they would see that that cancer was too far gone to cut out, so they would sew the patient back up. And obviously they had such an advanced cancer that they died soon thereafter.
Okay.
Well, you could see where family members seeing that saw this maybe relatively healthy person that rapidly deteriorated after surgery. So the myth grew that oxygen, once air hit the cancer, it would spread, that once the cancer was exposed to the outside world, but none of that was true. It was mere coincidence. But you could see this myth is propagated over decades.
Right, okay. Let's move on. And okay, so Sis just has a question. She says that she lost her brother to liver cancer. He only lived a month. Is that normal?
Well, first, I'm so sorry to hear that. It is not the norm, but it absolutely can happen. A lot of it has to deal with where in the liver that cancer is and the other organs that it affects. That is a very short period of time, but without knowing the details. But unfortunately, we do see that sometimes.
And this is Missy has a question about when hospitals will reopen for caregivers. She says it is too hot to be sitting in the hospital parking lot waiting for patients. Do you have any idea? I know there's so many restrictions because of coronavirus.
Correct. And this is something I deal with on a daily basis as I see my patients. It is something that I'll tell you, as physicians, we have no control over. This is all done at the state level. I don't think it's going to be anytime soon, because the reality of the situation is, for instance, with my patients who have cancer in the hospital, if they get coronavirus, they will likely pass away from it. So unfortunately, I think that the states are going to keep those restrictions in place for at least another month or two.
Okay. Ian says, I know you can't catch cancer, but do you agree that people can lower their risks of certain cancer by getting the I can't read the whole thing, but it says, I believe, by getting the HPV vaccine?
Yes, that is absolutely true. And you are calling me out, and it is a little bit of a trick question, because cancer itself is not contagious, but the human papillomavirus, HPV, is contagious. If you get HPV, that doesn't mean you will get cancer, but cervical cancer and head and neck cancers, most of them are caused by HPV. So if you get the vaccine, both men and women, usually between the ages of 10 and 14, you can prevent cervical cancer and about 60% of head and neck cancers and anal cancers. So we do have the opportunity to wipe these cancers out.
Right, and now pediatricians are encouraging parents to go ahead and add it to the list of vaccines, because it's a very important one.
Absolutely.
Okay, that was Ian. Ian called you out on that one, but
that was a little trick question there.
Yes. Okay, so let's see. Let's add a few more myths in here. This is a good one. Vaping is safer than smoking. I won't get lung cancer from vaping.
So we don't know what the risk of lung cancer is from vaping, but there is a risk there. And then the problem is the amount of nicotine in vaping is higher than cigarettes, so it's much more addictive. So we know that traditional tobacco cigarettes will cause cancer because they've been around for so long, and we can put numbers on that. Vaping likely will end up causing cancer. We just can't put a number on it yet.
It is such a major problem, especially in high schools right now.
It absolutely is. It's unfortunately too easy to get access to and too easy to hide.
It is. All right, let's see here. Stress causes cancer and positivity prevents cancer.
So a lot of this goes back to the idea that when we're very stressed out, our cortisol levels go up, our adrenaline levels go up, and people start to make this causative relationship between elevated cortisol levels. There is no proof evidence that increased stress levels increase your risk of getting cancer. There is some evidence that it might be able to affect your immune system, but only very slightly. In other words, if you are very stressed out for a long period of time, your immune system function may be a little bit lower, but nobody's proven that it can cause cancer.
Okay, let's see here. This is one about cancer treatments. They are fake, just a money scam.
Right. So the issue there is that if they were a money scam, if some drug company had the cure for cancer, that's where the money would be. So I wouldn't be sitting here. The group of professionals that I work with that treat cancer, there is no way we would give fake treatments. And if somebody out there, you know, Elon Musk or somebody has in their lab a cure for cancer, I guarantee you they would use it and sell it, and that's where the money would be.
Right, right. Okay, I'm just going through some of these comments to make sure I'm not missing anyone. Let's see. Well, we're getting a lot of compliments about you, Dr. Heller, and how much people really appreciate your compassion and what a great doctor you are.
Well, that's very nice. I have to make sure I pay those people off for that.
Let's see here. Well, this person is just making a comment about reminding people that as far as cancer treatment is concerned, they can't do anything without your consent. So advocate for yourself, get second opinions, do your research. Do you have people that want a second opinion many times?
Absolutely, and as cancer doctors, because of the seriousness of being diagnosed and treated for cancer, we encourage that. I understand. A patient could trust me implicitly, we could get along great. They just may need to hear it from one other person that, yes, this cancer is incurable, but if we give you this treatment, we can make you live longer. I can totally understand someone needing to just go somewhere else and hear that same thing. And as cancer doctors, we're not threatened by that. I think there's a lot of good information on the internet and there's a lot of bad information on the internet. So I think it's important for us as doctors to steer people to the good information and also to be very open and accommodating if someone wants to get a second opinion.
Absolutely. Okay, let's run through a few more of these. Deodorants and bra underwires cause breast cancer.
This is a common myth. It goes back to the idea that there's aluminum in most antiperspirants, and there were some studies in animals relating aluminum to cancer. It actually didn't even pan out in animals. So that is a myth. There's no evidence that deodorants or underwire bras. There was a large lawsuit recently with baby powder and ovarian cancer. The data there is questionable. It had to do with the way baby powder was made years ago, but we can't say 100% when it comes to baby powder and ovarian cancer and GYN malignancies.
Okay. This person wants to know, where are you located? Her husband is a cancer patient.
So at Southern Cancer Center, we have offices at every hospital: Providence, Spring Hill, Mobile Infirmary, and then one by South Baldwin Hospital, and then we also have a freestanding clinic in Daphne. Myself, I practice out of our Providence Hospital and our Mobile Infirmary offices, but you can just look us up at Southern Cancer Center on the internet.
And I don't know what this person means. Kathy says, does Nash lead to cancer? N-A-S-H.
So what she's talking about is Nash is an acronym that stands for fatty liver. And so people can get fat stores in their liver. It's related to obesity. It typically does not lead to cancer, but what can happen is Nash can lead to cirrhosis, and cirrhosis increases your risk for hepatocellular cancer, but Nash in and of itself does not cause cancer.
Do y'all do any proton therapy? Gail wants to know.
So here in Mobile, there is no proton beam accelerator. We do have some centers that we refer people to if we feel like they need proton beam. Proton beam therapy has not been shown to be any more effective than what we think of as a traditional electron beam. They can just aim the beam of radioactivity at a smaller point.
Okay. This person went through pancreatic cancer, went through chemo, scans have come back clear, but her white blood count sounds like it's kind of low. Is there anything she can do to build that back up? So
unfortunately, there's nothing specific you can do. You need to talk to your doctor, obviously, and there's some tests they can do to make sure that all your vitamin levels are normalized. The good news is it's usually nothing to worry about. It is extremely common after you receive chemotherapy to go for several months, if not years, with a mildly decreased white blood cell count. It typically does not mean that your immune system is low. It's just something that we keep an eye on.
Okay, let's see if we have any best oncologist ever saved my life. Jennifer is a breast cancer survivor, and let's see. Yeah, so many compliments for you on here. Dr. Heller, in closing, let's just encourage people to see their doctor, something you and I were talking about earlier. You've had a lot of people putting off very important screenings.
It is critically important. We've seen at Southern Cancer Center fewer and fewer cases of cancer coming to see us. Now, normally I would be ecstatic about that. But unfortunately, I know what's happening is there's a lot of cases out there that have not yet been diagnosed because people aren't seeing their primary care doctor, they're not getting their colonoscopies, they're not going in because they're short of breath, they're not getting their mammograms. So I would encourage you all of the hospitals, the doctor's office are taking very strict precautions to keep you safe. So if you're due for screening, and importantly, if you're having a problem or concern that is out of the ordinary, please go in and see about it. The sooner that we can diagnose your cancer, we have wonderful new treatments, but the sooner we can get you to the right treatment, the better you're going to do.
All right, well, Dr. Brian Heller with the Southern Cancer Center has been our guest today for The Doctor Is In. Thanks to all of you for watching and for sending in your really good questions. Dr. Heller, we appreciate your expertise, your knowledge, and just for being with us today.
Thank you very much.
All right, we'll see all of you tonight for WKRG News 5 at 5. I'm Devin Walsh.